Hello and welcome. So yeah, if you're new to rats, one thing you may not know is that rats can get a lot of different sicknesses and infections and things like that. And sometimes you go to the vet and the vet isn't always very helpful, especially if they aren't an exotic vet, or even exotic vets. They're not always rat savvy ones. Hi, my cat's here. And then sometimes you end up having to advocate for your rat. Sometimes you go in and you're feeling frustrated because your rat's not getting better and you feel like you are just kind of running in circles doing the same thing and nothing's working. And that's because sometimes the vet isn't as well versed in rat medicine and what medications work. And so you have to really be an advocate for your rat, which again, yes, can be very frustrating, especially if your vet doesn't want to listen to you. But the best way to handle it is just arm yourself with knowledge and just go in and be very polite but stubborn. And that way you can get your rat the help they need. And so since I've had rats for a long time, I've gotten to the point where I know the medications pretty well, to the point where when I'm watching human doctor shows and they start rattling off medications, a lot of times I'm just like, oh, I know what that does. Which I feel like they don't expect the audience to. They're just like rattling off medications. But yeah, no, I know a lot of them now. So Cappy too. We often will watching TV and we just look at each other when they say medicine we know. But yeah, I just wanted to go over some medications, what they do for certain ailments, and this is by no means a comprehensive list of ailments or medications. This is, in my experience, the most common ailments and the most common medications for those, or the best medications for those based on my experience. So keep in mind that having rats is a very individualized experience. So just because these things work for me and my rats doesn't mean it's going to help you and your rats. But knowing what might help could help you and your vet come to a solution to whatever issue your rat is having. Another disclaimer, I stutter a lot, so the medications that are harder for me to pronounce, I'm just going to pop the name up on screen and I'll mention it so that you can pause and look at the name if you need that information. But yeah, I'm going to do my best, y'all. Let's get into it. So the most common issue rats have is going to be some kind of respiratory issue. Because they have very delicate respiratory systems. They're small animals. They tend to live in dusty environments, especially in the States, because even if you get some kind of dust extracted bedding, it's incredibly dusty. I don't think that's the same for every country, but in the States, you cannot get any kind of bedding that is not very dusty. You can just get ones that are better. So respiratory infections are extremely common, and you will end up with these medications. The first one I'm going to talk about is the one you're going to hear about the most, because it is a broad spectrum antibiotic, meaning that it can hit a lot of different areas in the body and a lot of different infections. So vets tend to lean on it a lot, even when it's not necessarily the best for the issue that the rat is having. And that is enrofloxacin or Baytril. So Enro, you will end up with Enro. If you have rats, you will end up with Enro in your life. You will become very familiar with it. I find a 50-50 on whether or not my rats will take it willingly. It really depends on the flavoring the vet mixes it with. My vets used to do a pina colada. My rats hated it. But I had a vet who mixed it with orange Gatorade, like the powder, and my rat loved it. She loved it so much. Enro is very good at dealing with respiratory issues. It gets straight to the problem, but it's often best paired with another medicine called doxycycline or Doxy. I usually have really good luck getting my rats to take Doxy, so again, this is my experience, but my rats do generally take it very easily. And paired up, these two you take care of most respiratory problems. Now you can get severe ones, in which case other measures might need to be taken. Another common medication used for respiratory, if Enro doesn't work, is something called azithromycin. And azithro is another broad spectrum antibiotic that is really good at handling respiratory issues. And it is not the easiest to get rats to take. In fact, most of mine refuse it. My vet would use a very thick, viscous syrup to mix it with, and they universally hated it. Not a single rat was like, yeah, I'll take this. They're all just like, I don't know about this. So, but those all are the most common medications used for respiratory infections, and typically they do work very well. The next thing on the list would be skin issues. So this can include things like abscesses, skin infections, wounds, that kind of thing. Now, wounds will often have some kind of topical antibiotic, which they do make a topical like Inro. They do try to do like that kind of thing, but the thing is with rats is they are very prolific groomers. They like to clean themselves a lot. So doing topical doesn't always work. It can work for things like mites, in which case it's a solution that dries very quickly, soaks into the skin very quickly, so it doesn't necessarily matter if they groom. But a lot of times with like wounds and stuff, they will groom off whatever you put on them. So oral medication is still the best option if you're trying to avoid an infection. Same with an abscess. Abscesses usually take care of themselves and they're not that big of a deal. But sometimes a more stubborn one might need some kind of antibiotic. And an abscess, in case you don't know, is when basically it happens a lot with like rat fights and stuff, but it's an infection that the body seals off into its own little like area, and typically it'll resolve itself. It'll just basically come to a head and it'll drain on its own, and it does not recur most of the time, but you can get stubborn ones that come back and back and back and back. So Inro is a common one used with this. Other ones that are commonly used with this are amoxicillin or clavamox. Clavamox is amoxicillin with the added component clavulinate, hence clavamox, and this can be really good for skin issues. Amoxicillin in particular is very good for that kind of thing typically. Another one we use pretty frequently is trimethoprim sulfa, and that one so it's clavamox and amoxicillin. I have great luck getting my rats to take that because typically the flavoring hides it very well. With the trimethoprim sulfa, my vet, and that's far away, the one I use for surgeries, typically uses this antibiotic for things. So like if they have like a wound, or like I remember Orville had like she had her glands that were like down by her genitals would get like impacted or something. It was really weird. They didn't really know what it was, and they've only ever seen it in one other rat. But with that, when they like chewed open a wound or when they had some kind of skin issues, they would use the trimethoprim sulfa. My rats hate it. I have never successfully gotten a rat to take it. It's usually like a higher amount of medicine that they need to take. I have never successfully gotten a rat to take it willingly. So it tastes very nasty. They do not like it. So keep that in mind. Another common thing rats get is a UTI. These are typically very easy to treat. Inro does actually really well with these, and so does amoxicillin. Sometimes you can get a really stubborn URI, in which case you might need to get sampled, send off and do some lab work on to see what other medications might work on it. But typically a UTI or urinary tract infection responds really well and really quickly to Inro or amoxicillin. Now, issues with the GI tract, which can happen. They're not very common, but they can happen. Rats can get any kind of infection anywhere, just like people can. And typically with this, again, Inro is one that you go to very frequently. Another one is, I'm not going to try to pronounce this one because I know this one trips me up, so I'm just going to call it Metro and put the actual name right here. That one is a very strong antibiotic, so it can really get in deep into the tissue. And then again, the trimethoprim sulfa is also often used for the GI tract. I have used the Metro with Ezra, and he did not. It tastes very, very nasty. They do not like it. I had to syringe him or he was not going to take it. My cat is about to knock you guys over. Now, for females with their reproductive tract, sometimes they can have issues. Typically, if they get some kind of infection within their uterus or ovaries or whatever, you're going to have to spay them. That's really the only solution a lot of the time, and it's often the safest solution. But sometimes the issues are minor enough that antibiotics can help. Again, I would always go for just spaying them, because even if you take care of it then, there is a chance that the issues will come back and it could be more severe, and spaying them is a better guarantee that they're going to live through the infection. But if you wanted to try antibiotics, there's an antibiotic called clindamycin, which is another very powerful antibiotic that can really go for very tough infections in very tough areas. The other two often used are, again, enrofloxacin or the trimethoprim sulfa. Another infection that is very serious, is a bone infection. A lot of times when it's like in a limb, like a leg bone infection or an arm bone infection, something like that, the best option is amputation. And much like other animals, rats can do really well with only 3 limbs. It doesn't really slow them down. They can still climb. They can do all the stuff that a full-bodied rat can do, and it doesn't necessarily bother them too much. However, the best medication to use for bone infections, they can also get them in their face, like along their jawline and stuff. If they have a tooth root abscess, the infection can spread into the bone. And the best thing to use for that is clindamycin, because it gets like straight into the bone, and it is the best chance of taking care of the infection through medication. Now, speaking of teeth or face stuff, because like the face and teeth are just very hard to treat with antibiotics. So you don't want to use Inro. Vets will always try to push Inro, and it will not work. If you have a tooth root abscess in your rat, so that's when, if you notice that their face is swelling, a lot of time that's a tooth root abscess or a facial abscess, or it can also be something called a Zimbaldi gland tumor. And the thing with the Zimbaldi gland tumor is it's not removable. It's palliative care. You can't really treat it, you can't really remove it. Typically it's just too deep set, and removing a Zimbaldi gland tumor, while it is possible, it typically makes the tumor come back even more aggressive if you can successfully remove it. A lot of time you end up breaking the rat's jaw, which is excruciatingly painful and not worth it. I have seen some people try, but it's just not worth it. And if your vet suggests that, I would recommend not going that route, because your rat's going to be in a lot of pain. However, if they have a tooth root abscess, which is also very serious, or a facial abscess, which is very painful, there are a few antibiotics you can use. So with Ezra, when he had his tooth root abscess, we did the Metro, and he responded very quickly to it. The swelling in his face went down immediately, and if he had been on the medication for longer, which is what I wanted, and I am still bitter about it, yes, I do think he would have made a full recovery, and he would have gone on for quite a while afterward, being perfectly happy. But the vet only wanted to do 5 days, and then when I pushed for more, by the time they let me have more medication, it was basically too late. So you definitely want more than 5 days worth of antibiotics in most cases for your rat. But yeah, so the Metro worked really well. Another option is the clindamycin, because again, it gets down into the bone. So like with teeth, it's really good too, because it can also get into the bone. So yeah, those are the 2 best options. I really like the Metro. Both of these taste really nasty, and rats hate them, like really genuinely hate them. So chances are you will have to, my cat's playing with my pen. Chances are you will have to syringe them, which is not the funnest thing, but they get the job done. All right, getting out of like infections, another common thing is neurological problems. So neurological problems can be an indication of an ear infection, a pituitary tumor, a stroke, these kinds of things. And the one thing you pretty much always want to do when a rat is showing neurological problems is get them on steroids. So the thing with steroids is vets really don't like to prescribe them very often, because the side effects can be so disastrous. I've lost a rat because of the side effects of a steroid, because steroids suppress the immune system. So any infections that are brewing or already in place can get way, way worse, because the steroid is keeping the immune system from fighting them. The thing with that is, if your rat is going to be on steroids long term, it is a good idea to also get them on antibiotics. The other thing with that is, with steroids, the reason you want steroids as opposed to normal medication, because things like Metacam or gabapentin, painkillers, they'll often want to do Metacam/meloxicam instead of a steroid. Those medications do not go into the brain, basically. The steroid does, and it will reduce swelling in the brain. So if they're having neurological issues, that is why you want a steroid. Whereas Metacam and meloxicam will not. So it might help reduce their pain levels, but it won't help any of the swelling that might be happening in the brain. Their symptoms could get way worse. And typically with neurological issues, time is of the essence. You want to get it taken care of very quickly. So you don't necessarily have time to mess around with just normal painkillers. What you want is a steroid. So the 2 steroids that are most commonly used, one that is often used as an injection, not an oral medication, is something called dexamethasone. And again, it works very quickly when injected. So like if you have a rat that's showing signs of a pituitary tumor or a stroke, if you do that, it works very quickly in bringing the swelling down. Now, one that is usually used as an oral medication is prednisone or prednisolone, which they aren't quite the same thing, but they're close enough. As for an oral steroid, you will probably end up with prednisone or prednisolone, which are very good at taking care of the issues as well. And the thing with oral steroids is you do want to taper off the medication. You don't want them to stop cold turkey because it can severely affect the rat in a negative way. So you always want to taper off oral steroids. Now, speaking of pain medications, again, there's Metacam and Meloxicam, which are typically used for severe pain, and they're usually given once, maybe twice a day, depending on how bad it is. There's another one called gabapentin, which is often used, and that one's good to use if they're also on a steroid, because Metacam, Meloxicam can have bad interactions with steroids because they're both NSAIDs, whereas gabapentin is usually a lot safer. Gabapentin can have like a sedative effect on rats. I find this is spotty at best. Some rats are really affected by it, some really, really aren't. So just keep that in mind if you end up with gabapentin. In my experience, rats don't really like gabapentin or the meloxicam Metacam. They tend to need to be tricked into taking it. With gabapentin, sometimes I have to syringe it, sometimes I don't. Like the Gravies actually took their gabapentin when they had when they were spayed, when Kelpie and Thistle were spayed. They actually took the gabapentin really easily, shocking me because every other rat had to be syringed. Another common issue is pituitary tumors. A lot of times you don't really have much of an option with pituitary tumors other than euthanasia, but if you catch them early enough, you can try medication, which would be steroids and something called cabergoline or Galistop in the UK. There's another medication called, you know what, I'm going to call it bromo because I don't think I can pronounce this one, and we're going to pop it up right here. Look at that lovely thing. And from what I've seen, my understanding is that it can be a lot easier to get the bromo in Canada than the cabergoline. So if you're in Canada, keep that in mind. I don't know if it's as effective as cabergoline, but the thing with cabergoline is it only affects one type of pituitary tumor. There can be a lot of different kinds of tumors that can occur in the pituitary gland, but one type can be managed with cabergoline. Cabergoline can also be used as a treatment for mammary gland tumors, but only certain types of mammary gland tumors. It's kind of spotty. A lot of times it's not going to work. Most of the time it's not going to work for pituitary tumors. But when it does work, it works really well and really effectively. So there is that. And now, finally, let's talk about heart failure. So heart failure is a very common thing with rats. More common than vets want to think, because vets really only like to diagnose things that they can find physical proof of. And so the thing with heart failure is it often comes with a side of respiratory problems. And so vets will just say it's a respiratory problem again and again and again, even if the medicine's not working, no medicine's working, even if, you know, they'd like to not listen when you say it's heart failure. But when they do listen, then the medicines you are likely to end up with are a diuretic. The most common is furosemide, or Lasix, I think is the common name. In my experience, vets just kind of want to stop there. They don't want to add anything on, but you might end up needing an ACE inhibitor or a beta blocker. And since I've never had that, I've only ever used furosemide before the heart failure got bad enough that I had to put them to sleep. These are the names of those medications that are often used. I'm going to pop them up on screen. My rats are okay with the furosemide taking it. They're not a huge fan. Every time I've used it, it took so much of the medicine. So like Honey, for example, she was like 400 some grams, and it took 0.5 ml to get for her, which is like half a syringe. It's basically half a syringe of furosemide. So I had to hide it in baby food and baby oatmeal because it was just so much medicine. And she did take it, but she wasn't like thrilled with it. She was mostly there for the baby food and baby oatmeal. And that's just like a typical dose. Even when I did my rat Daisy, who was smaller, it was still just a huge amount of medicine. And I got her to take it from a spoon because she knew if she took it from the spoon, I was going to give her a little piece of cookie. And that's all she cared about. And then Foggy would take it with baby food and baby oatmeal as well. So they take it, but they're not thrilled with it. But typically with my rats, they do take it pretty well. So yeah, those are just a lot of the common medications you're going to run into and the different things that work for infections that aren't enro and the things that you might need that also aren't enro or the basic pain management medications. So again, sometimes you're just going to have to be an advocate for your rat and fight for them to get the medications they need. it's good to have a working knowledge of what medications are used for what, so that you can suggest alternatives to your vet, and hopefully they will listen. So yeah, I hope you enjoyed that video. If you did, you know what to do. All the fun stuff down below, and I'll see you in the next one. Goodbye!